CDC released recommendations for fully vaccinated people, giving the green light to resume some pre-pandemic activities and relax quarantine precautions that have been in place. Joining me now to discuss is immunotherapist, scientist, Dr. Nissola. Good morning to you, Dr. Nissola. Good to see you again.
Morning. Thank you for having me.
So first, let's get some clarification on what exactly it means to be fully vaccinated.
That's right. Well, the CDC released the new guidance now based on the information that we have so far on the vaccination and the immunization. So if you have received 2 doses of Pfizer's and Moderna's vaccine, within the next 2 weeks, you are fully immune to the virus. So in case you received the J&J's vaccine, 2 weeks after your vaccination, you are allowed to now gather indoors, unmasked in some settings. Now, it's important to understand what the CDC is trying to do here. You see, fully vaccinated individuals are trying to rejoin society and are trying to get life back to normal as they should, and as it should be an incentive to getting vaccinated. But there is still risk. So I think the CDC new guidance try to assess what the threshold should be for each individual. And although it's a personal choice as far as what you should expose yourself to, this new guidance helps to give some clarity.
Gotcha. We actually have the list of the guidelines here on our screen. I want to focus in on that third one. If you don't have to quarantine or get tested when exposed to someone with COVID, why is the CDC still advising people to avoid travel? In other words, what's the big difference here from traveling and then being able to take part in those activities at home?
I think the biggest challenge the CDC has right now is the lack of control of who is immune and who is not immune, and releasing the red tape around these precautions is a challenging situation. You see, risky behavior is still not recommended. And what's risky behavior? It's pretty much gathering indoors with people that you're not from the same household and you have no control over. For example, movie theaters or churches or venues like indoor dining. They become more and more susceptible for other individuals who are not fully immune and perhaps are carrying the virus. And so becoming immune to this virus has a lot to do with the amount of virus that is available around you. So that's why the CDC is taking this overly cautious guidance and advocating for people to only gather indoors with other vaccinated individuals to reduce the chance of they coming across the virus one more time. As you know, even though you're fully vaccinated, there's still risk of catching COVID.
Gotcha. Now, I'm curious, Dr. Nissola, we're seeing states like Texas loosening restrictions, dropping mask mandates eventually sooner than health officials would like. If this leads to another surge, a fourth surge in cases, could the CDC roll back some of the guidelines that they've just released?
Definitely. That's definitely a concern. And there have been active conversations about what we should be doing in terms of states restricting or loosening their restrictions too soon. Me personally, I'm not a fan of mandates. I think communication and clear guidance should allow individuals to make their personal choice. But when public health risk mitigation measures like mask wearing and physical distancing prove itself to work on slowing the spread of a deadly virus, it's important for folks to understand that even though a venue may be open in your state, or like indoor dining, for example, you shouldn't partake because it's too risky for you, for your family, and for your loved ones as well.
Gotcha. Yeah, the light at the end of the tunnel is getting brighter, but we're not quite there yet. So, but certainly good to see this news come out. Dr. Nissola, thank you so much for your time this morning. Appreciate it.
Thanks for having me.
Steve, I'll send it over to you. All right.